Okay, so exercise, when it's done in the right way, is probably one of the most effective things for this. Even if it is a POTS, right? Even if you do have this dysfunction, we still get people to exercise, but we get them to start in a recumbent fashion. So they actually start with, like, let's say rowing or a recumbent bike, where they're able to kind of be, kind of more downward and not necessarily fully upright, because being upright is what causes this blood pooling to happen and they're not getting enough blood. But exercise actually helps your blood vessels. Do you know what another thing that causes dysautonomia? I listed a bunch at the start. One thing that causes dysautonomia is excessive inactivity. Okay? What do we tell concussion patients in a lot of times? Rest. Do nothing. Okay? Like just lie down, bed rest in some cases. That will cause your autonomic nervous system and the way it controls your blood vessels to become inhibited. It will affect your autonomic nervous system and you won't be able to respond. So that is a cause of dysautonomia. This is why I have such a hate on for people telling patients to rest. No, you should be doing activity. You should be moving. You should be doing light physical activity within the first couple days after your injury. The evidence shows that this gets people better faster, and this is probably why. You're not allowing people to sink into this dysautonomia type of phase. Sometimes you have no control over it, but I think we could probably prevent a lot of these by doing this right. Okay? So we put you on the treadmill. We figure out what your threshold is. Then we give you a sub-symptom threshold exercise protocol, 80 to 90% of whatever your threshold heart rate was. And we have you exercise at that rate every single day, okay, for a week or two. And then we bring you back in and then we see how you do on the treadmill test again. Are you able to pass? If so, okay, good. Just keep exercising. If you're not able to pass, we give you a new heart rate and we slowly, gradually work you up until you can fully pass. So exercise is one of the mainstays for helping to affect your autonomic nervous system balance, okay? Breathing exercises. So this is for all levels of dysfunction, but oftentimes if it's way up here, you may have to start with breathing exercises. If you want to think about the balance of the autonomic nervous system, in order to decrease sympathetic, the way that you do that, because it's on a teeter-totter, you have to increase parasympathetic. By increasing parasympathetic, we can deactivate sympathetic, right? So if we have this high sympathetic overdrive, we have to think of things we can do to activate the parasympathetic system. Exercise is that if it's done in the right way. Too much exercise, going too hard, can have a more stimulatory effect. So you have to do this in a sub-symptom threshold way, at least to start. You can ramp up as you get better at it, as you get in better shape, but to start, you want to stick with that sub-symptom threshold. The other thing, like I was just saying, is breathing exercises. So your diaphragm is highly connected to the parasympathetic system, okay? Deep breathing exercises, gradual slow breathing exercises activates a nerve called the vagus nerve, which is which is the main parasympathetic nerve, okay? So doing things that activate the diaphragm in a controlled way can increase your parasympathetic tone, which then decreases parasympathetic, okay? There's been research done using biofeedback, where they'll hook you up to a machine and you can actually see your real-time heart rate variability based on your breathing rate. And through this research, you can control your heart rate variability, and you can actually do training to improve your heart rate variability by doing breathing exercises. And even if you didn't want to go through a biofeedback thing, the breathing rates that they found in these studies was anywhere between 4.5 breaths per minute to 6.5 breaths per minute to maximize parasympathetic tone. So if you think about, time yourself for a minute and breathe slowly, deeply, full diaphragmatic breaths, okay? Breathe in and then exhale slowly, and then breathe in and exhale slowly. If you get your breathing rate down to 4.5 to 6.5 breaths per minute, and you do that for a few minutes, let's say you start with 3 minutes and gradually work yourself up to 15 to 20 minutes, that will have tremendous impact on your vagus nerve and tremendous impact on your parasympathetic system, which will then improve your sleep, improve all the other things that go along with increased parasympathetic activity like digestion. There's another technique called Wim Hof. If anyone knows of Wim Hof technique, that's more of like a deep diaphragmatic breathing, kind of more of a hyperventilation type technique, but that can be effective. I actually do that every single morning, and I've noticed that my parasympathetic activity, even just on my heart rate variability, has been improving by doing that. Chanting, singing, laughing, right? Activating the diaphragm and all the good mood things. Gargling. So there's another nerve called the recurrent laryngeal nerve that goes into your vocal cords. And by gargling, you're activating diaphragm and recurrent laryngeal. So gargling with water or, mouthwash even for a period of time is very stimulatory to the parasympathetic system, okay? Next up is cold showers or intermittent cold exposure, has a high parasympathetic output. So again, getting back to Wim Hof, if anyone wants to Google Wim Hof, it's W-I-M space last name is H-O-F, Wim Hof. He's this, crazy superhuman person that teaches these breathing techniques and this cold water exposure. And it's there's some pretty good science around it as well, but this is something that I've been kind of playing with as well. But there's something to this in terms of parasympathetic activity. And then finally is calming activities. So things, if you think about parasympathetic being, your activation, parasympathetic being the calming, doing things that can calm your nervous system like meditation, mindfulness, even talk therapy, things that are relaxation, walking in nature, grounding, right? Grounding is where you take your shoes off and you put your feet directly on, grass or soil because you're getting the ions from the earth and it naturally increases your parasympathetic tone. Walking in nature, being in nature, all of these things have this kind of reviving aspect to them because they activate your parasympathetic nervous system and they lower your sympathetic nervous system, which is your stress response, right? So if you think about doing these things, okay, so I'm going to go through them again. Exercise in a subsymptom threshold way increases parasympathetic tone. Breathing exercises or anything that activates the diaphragm, so deep breathing, 4.5 to 6.5 breaths per minute. You can also try something called the Wim Hof. Chanting, singing, laughing, gargling, cold showers, and anything that creates a calming activity like meditation, mindfulness, prayer, grounding, nature walks. Okay, so it's not just about doing one element. So even if somebody's just like this, and I've discovered, hey, this person probably has some sort of dysautonomic issue. They're complaining of digestive issues. They're not sleeping well at night. All of these things, they seem kind of strung out. Okay, and then they fail the treadmill test. Okay, maybe they're here. Maybe they're somewhere on this kind of spectrum. Either way, I'm going to go breathing exercises, cold activity, meditation, mindfulness, relaxation techniques, and subsymptom threshold exercise. Okay, I'm going to tackle all of that as part of it. If somebody's like way up, I'm going to go, okay, we need to check them for POTS. We need to have better, like a more robust dysautonomic screening, which I don't do. I send them away for that. But I'm also, in the meantime, going to say, let's start working on these particular areas, okay, to try and balance that out. So it's not about just doing one thing. It's about creating a routine where you do it every single day, right? A lot of patients say, well, I've tried that. But when you actually ask them, it's like, well, I did it like a couple times. That's not going to work, right? In order to do this, you have to work at it, right? It's what you do every single day that matters, not what you've tried once or twice, because it won't work once or twice, okay? It has to be every day. It's like exercising twice and thinking that you're going to be in shape. It's not how it works.